My name is Sherri Hammack, and I'm the project lead for the Texas System of Care statewide expansion initiative, and I work at Texas Health and Human Services Commission. Children's mental health has been a passion of mine for many, many years as far as the work that I do. And I think about children's mental health. Well, I'll tell you an incident. I was listening to some music with friends, and at a break I was catching up with an old friend, and I don't know if he said that because he knows that that's the work that I do, but he said, I just feel like if my kids are mentally healthy, that everything else is going to fall into place. I mean, you want your kids to be able to have relationships, healthy and supportive relationships with other people and with peers and adults, and know how to problem solve. I see children's mental health impacting systems and agencies. When you think about the mission of different agencies like education, juvenile justice, child welfare, public mental health system, when you think about all those different disciplines and systems, mental health is a thread that runs through that. I feel like I had the lens of looking at children's mental health and bringing that up, so it's not an afterthought. If even in the adult service delivery system, when you're looking at young people who are transitioning into adulthood and serving children and youth. So I think it's a constant thread that runs through all those disciplines, and it's a stakeholder, it's an investment we should make in all those systems and disciplines for children's mental health. 4 values that I think should be inherent in the goals for the way that we deliver services in Texas. One is family-driven care. And so families are allies. They certainly are the experts of their own children. And so they should be front and center and equal partners in their own individual plan of care or their child's plan of care. And as soon as a young person has a voice, they should be guiding their plan of care. Cultural and linguistic competence. I think Texas is such a diverse and diversely rich state, and that we need to be cognizant, we need to be aware of how we're delivering services and that we're not placing our values on the folks that we serve, so that we're looking at the culture of that family and including that in their plan of care. And lastly, the 4th value that I think would be something that needs to stay in the forefront of us and our service delivery system is community-based services. So that's not to say that when we're looking at out-of-home placements that those aren't needed, but they should be purposeful and meaningful, and we're looking for an outcome to move a child or youth back into a family, a safe family situation. Kids should grow up in safe families and not in institutions. And that's a broad frame for how we can deliver services to children, youth, and families in a community. So a system of care means something. It has values and guiding principles. I think it would behoove us as a service system is to really look at ways that we can collaborate, coordinate, integrate services to better serve youth and children and families.